HC3, Shared Clinical Record of Catalonia, Networking Health. The HC3 Shared Clinical Record is an electronic medical record containing all key details on the health and progress of any patient being treated in the Catalan healthcare system. Almost 100% of Catalonia's public centres are now connected to the system. Acute hospitals, social health centres, mental health centres, primary care centres, emergency primary care centres. Recently, rehabilitation and dialysis centres were also connected. HC3 is constantly evolving and will shortly incorporate data from the social services and other areas. The health centres submit key healthcare information on patients via a number of services and systems. This information is recorded in HC3. Information is exchanged via interoperability mechanisms and the use of international standards between information systems. This makes clinical records from different health centres compatible with each other. Thus, HC3 facilitates and improves the task of professionals in different healthcare areas by enabling the shared use of patient information available amongst all the health centres in the network in Catalonia, 24 hours a day, 365 days a year. HC3 is the tool that gives our healthcare professionals access to key clinical information for every patient, so they have an all-round picture. HC3 provides support for the Catalan healthcare model. One of the basic objectives of HC3 is to ensure the continuity of healthcare, preventing the duplication of tests and the subjecting of patients to repeated examinations. With HC3, all professionals in Catalonia involved in the care of the patient have access to the shared information, which favours appropriate, quality healthcare. The tool helps make the Catalan health system more efficient in every sense. Time, quality of service, use of resources, data assessment, etc. HC3 gives professionals and patients greater confidence in aspects of security and confidentiality. The system guarantees the traceability of each entry to the system, and the information is transmitted securely and univocally. HC3 means greater health and improved quality of life in Catalonia. In the professional viewer, HC3 provides the following information. The heading contains the patient's details, marking as a patient with a complex chronic disease, PCC, and patient with an advanced chronic disease, MACA, and the individual and shared intervention plan, PIIC, which is assessed by clicking on the PCC or MACA icon. The clinical risk group, CRG, is also shown, classifying and predicting the patient's risk level. The tabs show which reports are available. It is also possible to consult diagnoses, medication plans, vaccines, data registered in the Catalan National Health System, the shared clinical course, which will be available shortly, and notification, where advanced directives are listed, and also, if necessary, information from the Directorate General for Child and Adolescent Care, DGAIA. The following can access the information contained in the HC3 records. Doctors, nurses, and other professionals working in diagnosis or treatment support services during the period the patient is receiving said service. The HC3 system is based on a proactive model involving professionals from a range of areas. Thanks to the collaboration of all health centres in the publication of data in HC3, Catalonia is improving healthcare and offers its professionals greater support. HC3 means increasing and sharing information. Health professionals can use two methods to look up information in the HC3. By using the professional viewer in the HC3 system itself, or by incorporating data from HC3 at clinical workstations in health centres. so that all information available in HC3 can be integrated directly in any health information system, highlighting that this information comes from HC3. This new integration function makes the system more usable and makes it easy to access all of a patient's details in just one click. With integrated HC3, information is more accessible. HC3 is constantly evolving. It is a dynamic working tool, and new functions are constantly being added. At present, users can work with structured data, establish comparisons, and incorporate messaging and alerts according to the data published. All this means that HC3 currently has quality policies in place and the option to support the use of clinical indicators of information published or consulted. HC3 Networking Health. Ministry of Health, Government of Catalonia.